Hi everyone, today we're going to be discussing bringing the patient charts into the digital age. And it's about how electronic medical record can benefit the hospital. I welcome all of the administrators, the boards of executive to talk about this issue. As you can see in the top photo, we have a cluttered and hard to find data. Those used to be our patient charts. And when you had to find something, it took forever. Down below, that's an electronic medical record. It's organized, it's detailed, and information is available at a click of a button. So what exactly is an EMR? An EMR, or an electronic medical record, is a legal record of what happens to a patient during their hospital stay. This can include results of tests and labs, clinical documentation, and orders for the patient. It will have the patient's history and physical, physician progress notes, referrals, insurance information, allergies, current medication regimen, and so much more. Imagine thousands of patients' charts fitting onto a drive that takes up next to no space that used to fill 10 filing cabinets. Now they're all available at a click of a button. Let's go over some more ways an EMR is beneficial to the organization. Back in 2009, President Obama mandated through the American Recovery and Reinvestment Act that required the adoption of a meaningful use of electronic medical record. This was to be done by all healthcare professionals and eligible professionals. In doing this, it would ensure that current reimbursement levels for Medicare and Medicaid were maintained. Meaningful use is using digital, medical, and health record to improve quality, safety for our patients. Have the patients be engaged in their care and also protect their privacy and secure their health information. Incentives for organizations, depending on the size, are up to $2 million for establishing an EMR. A penalty of 1% reduction in Medicare reimbursement if organizations were not compliant. What are the major advantages of switching to an electronic medical record? There's improved accuracy in charting, medication delivery, and access to information. There's better patient outcomes, and there's improved reimbursement and revenue for the hospital. Let's look at improved accuracy in charting, medication delivery, and access to information. The charting is legible. Charts used to be big, cumbersome papers that sometimes were illegible. Doctors did not write very clearly. Orders were scribbled. People were unsure of what they said. It had a delay in care because people had to stop and see what was being said. There's an electronic signature in an EMR, so there's no question about who performed a task. When you're in the chart, when you're signed in and you do a task and you chart it, you are electronically signing that it was you. Barcode scanning for medication delivery, meaning when you're in the patient's chart, you have to scan the patient's ID band and then the medication that they are receiving, make sure all the checks are right and that is the correct medication for that patient. There's also alerts built in for medication delivery. So if it's the wrong medication, the wrong dose, or there's an allergy, an alert pops up on the screen for you to be alert to a negative situation. Test results are available at a click of a button. So when a test is performed, an x-ray is done, when they go down and put it in their system, it's available immediately. There is no other system that has to be done. It's available to view. Let's look at better patient outcomes. Patients feel they have a voice in their care. You're in their room, you're taking care of them, you're assessing them, you're charting there. They feel they have a better connection with you. They can remind you of something. If they forget something, you're there to tell them. They don't have to hit the call light to have you come back to their room. You're not at the nurse's station charting away from them. You're in their room, connected. Allergies are clearly listed, which brings a better patient outcome. Again, barcode scanning for decreased errors in medication administration leads to better outcomes for the patient because they're getting the correct medication at the correct time. And there's quicker access to test results, which means better outcome for the patient, less time in the hospital waiting for test results to come so they can be taken care of quicker. Improved reimbursement and revenue for the hospital. Charges are captured as you chart. In the EMR, electronic medical record, there are charges built in. So as you chart that you did certain things, there will be a button to click that you dropped a charge. And whereas before in the paper charting system, if you did something, there was a separate system that you had to chart in that you to drop the charges for someone else to go put the charges in at a later time. There's accuracy of charting leads to better reimbursement. As you're charting, as you do things at point of care, the accuracy is there because you don't have to remember 2 hours later what you did or what time you did it. It'll lead to better reimbursement because there will be no question as to why you did something. Less chance of Medicare fraud when you're documenting what you do, why you do it, the doctor's order, and the need for the procedure or medication or anything. Um, you can't, there's less likelihood of Medicare fraud because the patient has to be physically in the hospital so you can scan their armband. Protection from litigation. So when you are charting electronically, it is very legible, it is very accurate, it is time stamped, so it will lead to less questions in what you charted and why. So let's wrap it all up. We have discussed many reasons why switching to an electronic medical record is beneficial to the hospital and the patients we serve. It has positive outcomes for the patients and can increase our revenue for the hospital. It is a win-win situation for everyone. Thank you for listening to my presentation. I hope it cleared up many of the questions you might have had about switching to an electronic medical record. Thank you for joining.